Forgive me if I'm a little nervous. I've rehearsed what I was going to say in the car probably about 15 times, the ride from home to here. So first of all, I'd like to introduce myself. My name is Alexander Annunziata. I'm a Community Resource Corps member, which is a branch out of the AmeriCorps office located at Dartmouth. We were created from a grant for the opioid crisis in the area. Right now, I'm working out of West Central Behavioral Health and also chosen to work on the IDN project out of the Heater Road in Dartmouth. So my journey from recovery to community health worker, interesting, colorful but interesting. So I have a personal background in substance abuse and misuse disorder as well as mental illness. I was active for about 18 years in and out of our incarceration system, coming through the Department of Probation and Parole here in New Hampshire. In about 2008, I decided, well, something needs to change. The cycle of life just continued to get worse. I continued to pick up more time. I continued to pick up more ailments in my body, broken bones, missing teeth, not being able to keep a paycheck, save any money, have a place to live, homelessness, in and out of jail. And in 2008, I decided to try and make a mental shift. I said, I need to take responsibility for my actions. I need to really just change my life and move forward from here. I got on probation and parole. I got involved in the 12-step programs, local, and hung on to that for about a year. And my addiction decided to come back. I wasn't addressing things fully. And by 2011, I had found myself on a maintenance treatment program. And it kept me alive, honestly. It kept me off in the streets seeking recreational narcotics. But in the meantime of all this, my shoulder had been dislocating probably every other week. I was in getting it reduced, put back in socket. I had blown out my meniscus. My mental health had deteriorated to the point where I was diagnosed with four mental illnesses: post-traumatic stress disorder, borderline personality disorder, chronic depression, and anxiety. And I was put on different medications, and one of the reasons I'm so excited to be working on this project today is because I've seen a lot of my own referrals slip through the cracks, a lot of my own complex care just kind of get left wayside, and certain things get addressed and not other things. By 2014, I was in full swing of my addiction again. I had tumbled back down, and 17 months ago, I'd had enough. I said, I need to seek a little bit more treatment. And really what began to happen was when I went into Southeastern New Hampshire Services, a lot of organizations coming back out of treatment have wrapped their hands kind of around me. A lot of people in my community, I've had a lot of support. And it really speaks to what you guys are doing here, because you are adding additional support where other patients haven't had it. You're eliminating the area where people might lose, a little bit of care. Releases are not quite followed through with, or information is kind of left out, and people's care is lacking. So I'm really excited for that here. So my journey took me out of recovery into recovery, April 11th of 2017. And I would be considered into long-term recovery now, and just happy to be able to stand before you. I met Christine Dyke and decided to sign up for the AmeriCorps program. My heart was really engaged in wanting to help people in the recovery and suffering from the opioid crisis. And in doing so, I was also trained as a recovery coach, community health worker. Got a lot of the fancy trainings you see up there with motivational interviewing and mental health first aid. And honestly, was just given an awesome opportunity to sit here, work with all of you in this profession, give a perspective from the patient side of things and just be of service any way that I can. Working down at the West Central Behavioral Health Office, I'm able to co-facilitate groups, able to work with clients and communicate with them effectively. I just feel blessed to really be in this role and be able to give back to a community that's helped me repair my life from, I was knocking on death's door, to being able to stand in front of you today and feeling healthy, being of sound mind, repairing my life monetarily, you know, financially, slowly but surely. And it's just really an honor and a blessing to be able to stand in front of you guys and share a little bit of my story and what it is, you know, that I feel called in my heart to do. So thank you.